if we're just imagining that our armpit is like a drain hole in the floor and we just want to squeegee that fluid towards the drain hole, that's usually going to get us where we're going. But we're also stimulating those lymph nodes. We're clearing them out, creating some space in there, getting circulation moving.
I gotta get myself a little more faith, a little more love.
I'm your host, Christa Bigler, and I'm going to guess we have at least one thing in common, that we're both in pursuit of a less stressed life. On this show, I'll be interviewing experts and sharing clinical pearls from my years of practice to support high-performing, health-savvy women in pursuit of abundance and a less stressed life. One of my beliefs is that we always have options for getting the results we want, so let's see what's out there together. Today on The Less Stressed Life, I welcome back Leah Levitan. She was here for episode 263, Lymph Love with Leah Levitan. And today we're getting a little bit more granular, a little more specific. We're talking about kind of the reproductive system in general, reproductive health, breast health, etc., and lymph. So Leah is a massage therapist and certified lymphatic therapist. She's the owner of Align Massage and Lymphatics in Austin, Texas. And she's founder of Lymph Love Club, where you may follow her online. She does lots of voiceovers over body parts, and they give me a great giggle. I think what's really unique about Leah is she's got a really fun approach to education, and we're all looking to be entertained. And so she's really fun to follow. And I am so fortunate to have met her in person a few times. And today I'm happy to have you back.
Thank you so much for having me. Happy to be here.
Yeah. Okay, so today we're trying to cover a couple of topics around lymph. So last time we got together, we did some basics. We talked about lymph nodes versus lymph system, lymph drainage, lymph stagnation. And actually not very long ago, within the last couple of months, we did a republishing of Perry Nicholson's lymphatic drainage episode where he went over the big six. So we've covered a lot of lymph basics, and today we're getting into some more specifics. And so I always love to start with a story. And instead of starting with your origin story, since we're talking a little bit about breast health, do you want to jump in and talk to us about breast health and lymphatics and how something that's wonderful? So I work with a lot of people with eczema because I have had eczema, not because I wanted to work with that condition, but because it found me. And then people find you when you have this unique perspective or understanding and appreciation for the particular thing. And so I always think it's really nice if the practitioner has some experience with a particular symptom. And you shared with me before we hit record, you have some experience around breast health and fibrocystic breasts. So if you would tell us your story about that, we'd love to hear it.
For sure. Happy to share the details. So my mom had breast cancer when I was younger, up and coming, maybe like 12 or 13. So that seed was planted very early that we need to take care of this area. And my mom was doing a lot of holistic healing. So dry brushing and coffee enemas and juicing and all of lymphatic drainage and all this stuff. And this was back in the 90s. So that was pretty far,
she was pretty
far out.
Yeah, pretty great. Did you grow up in Austin or California?
Oh, Asheville, North Carolina, actually.
North Carolina. Your mom, that was pretty great. My mom was into homeopathy growing up, and I feel like that really created an impression on me. But what your mom was into, she's quite progressive. So amazing.
Yeah, totally. So she's in good health and she's doing great now. And that's really awesome. And that has led to more awareness around my breast tissue. So I think my history with the bra was really almost the typical one. You start to develop and you intuitively want to strap them down. You want them out of the way. They're in the way and maybe a little bit embarrassing. Mine developed one sooner than the other. And so I was a little offside. So I had to put tissue paper in one side of my bra to even it out. And so the restrictive bra, the sports bra, not really understanding the shoulder joint, just getting into exercise in my early 20s, just like early adulthood. It was very much like, all right, what can I do? I'm going to do my big muscles and not really work on my functional movement. So I had a little bit of restriction in my shoulder girdle and I wasn't moving my shoulder as much as I needed to be. I also think that I was dealing with some iodine deficiency because I did have fibrocystic breast. So just dense, bumpy, kind of cyclical breast tenderness stuff going on. And I've come to realize that so many of my clients are also dealing with that. Very relatable in that sense. And this was all before getting into the lymphatic system, learning about the lymphatic system, learning about the drainage pathways of the breasts and how the breast itself is an extension of the shoulder girdle. And because there's no pump for our lymphatic system, we really have to use muscle activation or gravity and things like that to get this fluid moving. And so a bra can change the way that we breathe. It can change the way that we move, and it can create a physical barrier for our lymphatic fluid. So anything with a hard U-shaped underwire, it's best to avoid hard structures in the bra. It's okay to have that support. I think in regards to the statement of bras causing cancer, I feel like it's always up to so many other factors. And then also, what is the relationship with the bra? If you have to wear a bra, that's fine. Because I think a lot of people deal with breast pain as well. Yeah, I just have this like boob routine now. And I didn't really realize that the lymphatic system played such a huge role in clearing out the breast tissue. This is like our cancer fighting system as well. Just connecting those two things. And I forgot the cyst as well. My interaction with the vibration plate.
Oh, yeah, we'll get to that. So first, I just want to understand a little bit about the timeline. And I don't remember this from our conversation before, but when you started studying manual lymphatic drainage, I'm sure it was a whole rabbit hole. I think you were probably doing massage before you got into manual lymphatic drainage. I wonder if I know when I was adding tools to my toolbox, it's because you're like, I feel like I need this and you help clients next, right? And I wonder if your own experience with your breast health played into you pursuing some of that manual lymphatic drainage stuff. And then do you remember were you officially diagnosed with fibrocystic breasts, or did you self figure out that you had fibrocystic breasts?
I think the first time that I found out was the first time that I got a mammogram.
Yeah.
I was super young and it was like, oh, we need to be doing these a little bit early. We need to start screening earlier because of your mom's history. She ended up getting the genetic testing and tested negative. So it was environmental, but at the time for many years, we didn't actually know. And so there was a little history of cancer as well. So we wanted to be.
When did you start your mammograms?
I think 35 is when they wanted me to start.
Okay.
I've done a few, but then I do other imaging now.
Okay. So you found out about the fibrocystic breast for sure around 35. And what I wanted to drop in here was, I think this is a pretty valuable topic. I have a lot of passion around this topic because the current stats for cancer are 1 in 3, but they are projected to be 1 in 2. I forgot what year that is. It's not very far away, which is very significant. And in the United States, our most common cancer is breast cancer. We all know someone affected. And so I just like to I'm really interested in equipping the people who are listening to this podcast, my friends, my family, et cetera, and whatever we can do to support against this. And you just brought up the lymph system is like this cancer prevention system. You started getting mammograms around 35. You find out you have fibrocystic breasts. And this is why I like to just put timeline on things. And this is before maybe you're doing manual lymphatic drainage. And then what happened? What's the progression of the fibrocystic breast situation for you? Did this answer any questions for you? Or you're like, didn't know that was coming?
I think it just led to a bunch of other questions because I wasn't really sure what to do about it. Nobody really gave me any advice about what to do about it in regards to just dropping it on me and being like, cool, you have this. And that's it.
And let's qualify, what's the significance? When they tell you have fibrocystic breasts, what did you learn after the fact? So you got no context. And you make such a good point. I think that I think you weren't necessarily pursuing a diagnosis. You were pursuing clearance of breast cancer prevention, right? But very often when we're doctoring, we're looking for a diagnosis. And very often that diagnosis actually just leads to more questions, right? Just underlining that in your story. Carry on. Tell us more. Like what happened next?
Okay. So I feel like I've made a lot of progress, and that has come from the lymphatic rabbit hole and then looking at the fluid dynamics in the body. How does fluid flow through the breast? If you're imagining just you're locking eyes with a nipple, it's going to be draining out from every direction, almost like a star. So the medial portion of the breast will drain towards the sternum and the lateral portion will drain towards the armpits. So it just makes the fibrocystic structures within the breast make it a little bit harder for that fluid to flow through the squishy pipes. So looking at that and being like, okay, I need to move my shoulder more, change the type of bra that I'm wearing, make sure that I'm able to sweat because we do have like special lymph nodes in the armpit and there's special sweat glands in there. So we want them to be able to do their job and sweat freely. And then also to mobilize the breast tissue. It just feels like sometimes they exist as this extension of our chest and we put them away and they don't get a whole lot of action. And so because they're designed to move and they're designed to swing, they move up and down and side to side and forwards and backwards. And so when we're walking, the most nutritional movement that you could possibly do for your body, I like to go on a braless walk every day, and that allows them to move in all the different directions that they're able to. And I do prioritize a little bit of shoulder stuff as well. And then as well as just like moving that fluid with my hands, with either whether it's through massage or sometimes I'll use gua sha stuff. I just mix it up with my
Yeah.
self-care. But there's a lot of different ways to move the fluid in our breast and chest.
Okay. I have some questions about some of the things you put on the list.
Okay.
If you brought up moving the shoulder, changing the type of bra. So I want to talk about whether you're speaking specifically to removing a hard underwire or across the back versus different. So I have these T-back, and I'm coming up with these questions because of innate experience, right, with wearing bras. And as a side, in case you have any feelings, I don't have strong feelings. I know there's information out there about this. I went mostly bra-free a while back, not because I believed that bras caused breast cancer, but when someone about my age was diagnosed with breast cancer that I was close to, I was like, I'm just not doing this. But what was interesting was it was like they needed some exercise to perk back up. And if I would wear a bra, they'd be like sad and floppy for a couple of days, right? And so I just think it's interesting as well. But what I will say is sometimes I feel like that was even more significant if I was like in a cross back T-back, which is why I'm asking, when you say change your type of bra, are we talking about underwire or like the way the straps are?
Ooh, that's a good question. There's just so many different types of bras out there, right? So I think we want to avoid like high compression unless it's a compression bra that's actually designed for the lymphatic system. And we would call that a compression garment. And there's lots of companies out there that make compression garments for women that have already had lymph nodes removed from their body. And now that they have an increased risk of developing a condition known as lymphedema, those bras are actually really great. I'm wearing one right now. And so it creates some structure and support, but I know that it's not constricting. It's creating like an even surface for the lymph to flow more freely. There's no like bands or constrictive like elastic. So it can be wire, it can be elastic. I feel like there's just so many different kinds of bras. It's hard to tell. If you feel like when you take your bra off at the end of the day that you're just, maybe that's a good indication that bra is like maybe not the most comfortable or the most lymph friendly. We want to relieve pain. A lot of people have neck and shoulder issues when it comes to like larger breast or dense breast. And so it is a lot of trial and error, but if we can try to find things that are a little bit looser and don't make us feel like we just want to rip them off at the end of the day, that's usually great.
I agree. Lots of trial and error. That'll be another podcast or another day. Experience is going bra free. All of the tips and tricks that I've arrived at. Okay, let's talk about changing deodorants. And so maybe these are simple. And when I was just going from your list, which is like you changed the type of bra. So I don't know if you just removed underwires. And then when you're changing deodorant, sometimes, and I'll use a kind of a personal story. I took someone to dinner the other day, and I worked with her many years ago. And I must have gifted her a deodorant years ago. And she's, I'm still using that one, but it doesn't really work anymore. I was like, I've used like 6 different deodorants since then because I like to trial and error to an extent. And so I would guess you're talking about an antiperspirant or aluminum to a natural deodorant. And if you have any other comments about that, I just wanted to qualify it because people might say, what does she mean by change deodorant?
Yes. Yeah. We don't want to like prevent sweating and we want to avoid any environmental toxins or at least limit our exposure because it is something that we use a lot of, right? We might apply it once, maybe multiple times a day, every single day for our entire life. So it's interesting to just look at the relationship with that. For me, I think I just had to do a little bit of work around the need to smell good all the time.
And I have some total feedback. I have some tips for people if they want around this, because I feel like I identify as a sweaty girl and I have lots of feelings about that. This is another great tiny podcast episode. But if my body odor stinks, first of all, it's partially my like how much coffee I'm drinking typically, or some of the intake contributing to that. And it's really toxic garbage that wants to get out. What causes stink is like bacteria. And so there's a few things I do. If my body odor stinks, I get in the sauna. I like sweat that trash out, and it's like immediately better because I'm massively reducing toxins. And then if I need to change the bacteria, and actually I had a friend, a practitioner friend, text me recently about a young child, one of her kids having smelly body odor. And I was like, maybe she just needs soap in her armpits because it's bacteria. And we just don't think about
exfoliate. I exfoliate my arm.
Yeah, there you go. I forgot about that one. Thank you so much for bringing that up. Exfoliation. What do we call it? There's like fancy name, armpit detox. That's like the trendy thing online. Armpit detox with charcoal, and I don't know if
you could do bentonite clay.
Yeah. Bentonite clay. There you go.
Yeah. I see people do lemon juice.
Oh yeah, I've never done that. That sounds real painful if you have armpit congestion, which we might talk about here. This is a good segue into armpit congestion after we finish talking about cysts. I like internal chlorophyll. That works nicely. And then I was just on a trip, and I would say different environments. I don't live in this environment where it's crazy hot. You do. You live in a place that for me is crazy hot. But sometimes like on trip, I like arrange my clothes. I feel like I've arranged my clothing around not pitting. There's just materials I don't like in my armpits whatsoever. And there's a deodorant I just personally I really like right now that's like a silver paste. And that makes sense because that, and I don't use it. It's like you'll use it once every a couple times a week, and it just keeps that bacteria at bay. It's called NUD. It's out of the UK, so it's super annoying to order, but the bottle lasts for like ever. It lasts for literally forever. And so I actually it's a really good like travel size tiny bottle. So anyway, side notes.
There's so many great ways to
bring it up, because sometimes that's a hard pass for a lot of people, and it's actually what if there was options for everything. So I just want to bring up those options. Okay, so let's talk about when this cyst burst that you told me about before we hit the record button.
Oh yeah. I got a vibration plate on a Black Friday sale last year. And I thought I'm going to use it every single day for 15 minutes at a high setting because I got this. And I don't need to follow my own advice of slowly introducing things to the body. So I climbed aboard and I used it for a few days. And I remember waking up day 2 and was like, my chest is like just a little bit sore. And I felt a little bit sore and achy. And then but I did it again that day because I don't know why. I was in a self-care spiral of like, more is better. Just shake it out. I must just have a little detox reaction. So I did it again for the 3rd day. And then that's when I realized, okay, I don't need to do this anymore because it feels like something's off. And it turned out that I did rupture a cyst in my breast.
How did you
I'm not wearing a bra. It actually like almost doubled in size and got really warm and scary. Then that just led to, going to the doctor, getting follow-up imaging and things like that. And then just a lot of anxiety during that time of like waiting and uncertainty.
What does it look like on imaging if the cyst ruptures? Can they really tell?
I basically waited a little bit for that to go down to where I was back to like my baseline before getting that imaging. My sister's a nurse. And so she was just like, if you go in right now and ask for imaging right now, going to lead you down a path of all these diagnostic things that they want to do. I chose to just wait for that infection to clear with antibiotics and just like a lot of self-care. And then I was working on my gut and things like that. So
thanks for bringing that up, because I think that when there's obvious signs of infection, your breast had doubled in size, it was warm, it was painful to touch, etc. I always say, like, when you have a crazy infection, you need to put out that fire. There's really just no exception. You could get very sick when you don't put that down. But this is like when antibiotics have a use, like the biggest use, when there's like a infection that's potentially more dangerous not to treat than to treat. I would say like the pros outweigh the cons in that scenario.
Absolutely.
And I experience that with clients like every once in a while. And so I just welcome the use of the tools at our disposal at the right times for those. And so I just wanted to underline that part with you. So you did some imaging, so they didn't really catch much, and they were like, hey, this is probably this. Is that what I'm understanding?
Yeah, that's what it was, and that my imaging was clear. So it was helpful.
How long? Oh, that was just this year. That was a fun little experience
Last year,
for you.
yeah, November.
Oh, yeah.
Yeah, November.
Yeah. Okay. So now when I'm watching you educate about vibration plates, I'll think of your ruptured cysts on your breasts. Yeah, I'll be thinking.
And then that sort of led to people asking, was it possible that you could rupture like an ovarian cyst or anything like that? And I think, yes, vibration plates are just so incredibly powerful. So they just need to be respected.
Yeah, I've walked through with clients. I don't remember the cause. I don't really have any modalities that would necessarily be doing this, but where they thought that they had a cyst rupture just because of the pain. I don't remember what came of it. Nothing quite like yours. Nothing. It's like the stuff that is etched in your brain. So it's not a real vivid memory, but I know that it is a very painful, unfortunately painful thing. You brought up iodine, and we've had Dr. David Brownstein on the podcast, which is an honor because he doesn't really accept that many podcast invites. I don't know if you know who he is. He's like the iodine guy in our current health generation, I feel, that's alive. And so I wanted to ask you about if you use iodine and how you use it now in your fibrocystic breast journey, and if that's a debated topic, or do you ever get pushback around that?
Oh, good question. I do. So after the cyst sit, I created another level of self-care for my breast.
You're like, I'm actually going to crank it up a notch.
We're going to turn it up a notch. So I started using a red light unit on my breast for about 20 minutes a day. And then I would follow that with breast massage using an oil that had just like some herbs and a little bit of iodine. And it's been really helpful.
How do you know it's been helpful?
Because of the texture and just the tissue density is changing and softening.
That's pretty cool.
And so I can tell that tissue is clearing and that inflammation is not as present because I'm not getting that cyclical breast tenderness as much anymore. And yeah, my girls just feel softer.
Yeah. And you are a tissue expert. You've touched a lot of tissue. And so I would trust you completely to say, I can tell my tissue is changing. I think we all have different levels of awareness, which is why I asked you about that. And I just wanted you to highlight that a little bit because I think topical use of iodine's been in the toolbox for decades at least. But it's a lot
of people are deficient as well. It's pretty common.
It would be pretty hard to be adequate in iodine because we don't really have, unless you're bathing in the ocean or eating like kelp, like the food sources for iodine are very low. And so then you might say, what about salt? I've got like a handout that shows like how little we have. And I am just camp. I have had like dramatic life improvement with iodine. And so, but it's one of those topics that I have to educate you first because there's some details around it. But I would say that it can be a point of confusion for a lot of people because they aren't fully educated about it. I can't remember every detail. There was, I don't know if it was the 80s, 90s. I feel like it was the 80s, 90s. We quit using it because there was like a scare. And I think I'm probably dumbing this down a little bit, but it reminds me of like when we were afraid to eat whole eggs. We need to go back and strip away some of the crap around that. Because what happens is this stuff sticks in our brains. And you feel like people forgot about that stuff, but they don't. And so anyway, there's some literature on either side, but I'm really pro camp iodine, but I do think it just requires education, understanding, and then see what happens. Do a little trial and error, do some intentional experimentation. And I bring this up because like your story is, let me try some experimental implementation and I'll give it this amount of time and I'll see what happens. And that's all good too. So there's a lot more we could say about that, but check out David Brownstein's episode or some of his books. His episode's actually pretty dramatic.
And I do supplement. I do like almost like a sea algae type of supplement. Chongus crispus, I think is what it's called.
I don't know that. I was wondering if you were going to say like this other.
Chongus crispus.
I feel like
it's a weird spelling. But yeah, there's like a sea algae combination that I use. It's just a food-based supplement. Good quality.
Yeah. And I think I'll just throw this in. We're not just deficient because we're not intaking much. Part of the reason we're deficient is because we have things in our environment that are more prevalent now that are competing with the iodine receptor sites, namely other halogens like chlorine and bromine. you're probably familiar with chlorine and the fact that like people bathe in chlorine. Actually, it was a huge part of my skin story. But also bromine is in a lot of stuff, but it's not, you would never know it. Once upon a time, I worked with some kind of engineer that their company put bromine in. He's like, it's in everything. It's like in everything. But it's also one of the big topics in one of Brownstein's books is when they started putting it in flour as a dough conditioner. And so I just think it's part of the conversation with tolerance of grains in general, in my opinion. I don't think it's all about gluten. I think it's about other stuff, like the processing that happens after the fact also. So just some total rabbit holes that we didn't totally need to get into. So you had this fibroid burst last year. You took care of the infection and you amped up the boob routine. You've added those other things. Anything else to share about that? Or is there anything else that you want to mention about breast health? Or are there breast conditions women come to you for?
Yes. So cyclical breast tenderness, a lot of times after breast cancer. So I see a lot of breast cancer survivors. Maybe they've had lymph nodes removed or they've had surgery or radiation, chemotherapy, things like that. And so they're wanting to learn how to take care of their lymphatic system. They didn't feel like they got a whole lot of information. Not a lot of breast cancer patients are actually being referred out for physical therapy after cancer treatment, which I feel like is so important.
Yeah.
And so that is the largest majority of the breast stuff is working with scar tissue or maybe post-surgical. They're coming in with that acute situation where we're trying to lower inflammation, reduce the development of scar tissue, clear out some of that swelling after surgery, and just help their body repair as quickly as possible.
And I'll just point out, we also had your colleague, Jean Lamantia, talking about lymphedema, lipedema, which I think we got into this territory a little bit, episode 381 in about mid-December 2024, if people want a little bit more around some of those specifics. Post-cancer stuff, we definitely talked about post-cancer stuff because she had cancer, and I think some of that stuff as well. Okay, moving from the armpits a little bit, not too far at all, let's talk about puffy armpits, which is one of those things like maybe doesn't have a diagnosis. But for example, I couldn't believe the amount of people that used to be in my Instagram inbox, and I'm going to do an episode on this, asking me about HS, or I can't even say the diagnosis, hydrodentis suppurativa, I think is, I hope I got the mouthful out. But that might be a diagnosis related to puffy pits. But you said it's a kind of a hot topic. So let's talk about puffy pits.
Yeah, I feel like the basis for the puffy pit, what's the requirement, is that there isn't like a little cave in the armpit. There's something that actually protrudes from the armpit. But this area is a common place for congestion. And sometimes it's the anatomy of the person. It has less to do with the fluid dynamics in the shoulder and the breast, but it can also be hormonal and then related to those environmental things that we talked about, right? The bra, the deodorant, the lack of mobility in the shoulder. Sometimes it can be scar tissue related, maybe from a breast reduction. Sometimes women get a little bit congested just because of that scar tissue slowing down the lymphatic flow. Most of those clients are beyond happy that they got the reduction, by the way. Their quality of life has gone up. So not to deter anyone from breast reduction surgery. That congestion is super mild, but it's just one of those things where it can happen. It is an area of the body that's prone to congestion just because we're doing a lot of driving and we're doing a lot of computering. And so our arms are down at our side all day and it can be important to get in there. But
that's such a good point, a good reminder, right? We think about movement, but I think we think about movement, I usually think about moving my entire body or my legs. And so it's just good to think, what if I'm just sitting here and moving my
working my armpits? You're like, I'm just exercising my armpits.
I hope we use this clip. Like the chicken dance.
Yes.
I invite you to come up with a chicken dance for puppy armpit.
Okay. I could actually wear this sweater.
I literally feel like that sweater is perfect for this new idea. I can't wait to see that one. Okay, we're missing anything on puppy pits? Because I forgot about mastitis, going back a step to breast health.
Yes. I feel like it's so common for people for breastfeeding moms to develop a little bit of congestion in the armpits because sometimes the milk ducts go all the way up. Have you seen that video where the lady's squirting milk out of her armpit?
Oh my gosh, no. And I don't need to see that video, but thank you.
Okay. You're welcome.
Doesn't
But when
excite
I
me.
saw that, it blew my mind. And I remember thinking like, oh, okay, this is really contributing to their BO and the
Okay.
congestion that they're having. It just all made sense to me. I was like, oh, okay.
Yeah.
So it can be something where you can support because the lymph nodes can become enlarged and inflamed depending on what is going on. And so I do recommend that's when you would get in there and do some work on your armpit with your hands to pump those axillary clusters. We do the big 6, but then we got to add on a little bit of extra. Some self-care sprinkles are required to make the big 6 something that is a little bit more customized for what you have going on in your body to linger in those areas that are affected.
Okay, this brings up a couple of questions.
Yes.
Let me start with this one. Okay, you brought up that I think you said you do a little gua sha in your armpits for your breast health.
Yes.
And I was thinking about what is appropriate and can we hurt ourselves or not. I don't feel like you can ever hurt yourself moving your, of course you can hurt yourself moving your body, but doing the chicken dance for your armpits, I don't feel like you're going to hurt yourself with your body. My question is, with the big 6, the conversation is like opening up the drain in the clavicle first. And so if you do that, can you do gua sha? Like, can you go up or down incorrectly? Shouldn't you be going toward the large part of the body? And if you're going toward the heart or the center, can you do it wrong? Is there any issues that people can run into if they want to do some manual stimulation with their hand or with gua sha or with a stone? That's what I mean when I say gua sha. We've done episodes on that, but it's just a hard surface adding a little more, I don't know, pressure.
Yeah, just like getting the tissue red and increasing that circulation. Gua sha being like a fascial treatment versus a lymphatic treatment,
Sure.
you use a little bit more pressure. And I think that as long as we're not causing pain, then we're doing it right in that sense. I would try to stick with going with the flow. If you're brushing your bicep, you want to come down towards the armpit. If you're brushing along the bra line, you want to come up towards the bra or up towards the armpit. And the lateral breast, you want to work sideways. So if we're just imagining that our armpit is like a drain hole in the floor and we just want to squeegee that fluid towards the drain hole, that's usually going to get us where we're going.
Okay.
But we're also stimulating those lymph nodes. We're clearing them out, creating some space in there, getting circulation moving. So I find that I will often be mushing and squishing in all directions, but with just like there's a general one directional move.
Yeah. And I would guess that you witness a fair bit of die-off reactions, and that could look like a lot of things. But for me, when I started doing, I don't know if it was facial gua sha or the big 6, but I definitely got a zit like right here or somewhere. That's it. Moving some stuff. And I think to me, it didn't cause any alarm. It was just like, oh, I have crap. And this is not a shocker to me. I definitely have lymphatic crap. I have all kinds of it.
We all do.
Yeah.
We all do. That's its job.
Not blessed with my detoxification systems. And my other question was really, if someone was feeling like they were having mastitis coming on, would you discourage them from doing any manual drainage? At what point would you discourage it, is my question. Because like in a way, in my brain, it should make sense that it would be helpful, but then also it could be harmful if you have a massive infection. What are your thoughts?
You're
on that?
exactly right. We don't do lymphatic drainage when we have a fever or an acute infection that might get circulated into the bloodstream. After that lymphatic fluid has been cleaned and filtered by the lymph nodes, it goes back into circulation. So we don't want to stimulate too much drainage if we've got those infections. That's a more rest and restore mode, trying to replenish and heal and feel a little bit better before we do those. But if you feel something coming on, or you use it almost in a preventative way, you can help prevent them from taking hold. And then you can also take that heightened reaction and bring it back down before it does turn into an infection.
Okay, now traveling through the lymph system to the other parts of the system, reproductive area, pelvic region. Can we start with the more hot and heavy stuff, which is endometriosis. I imagine, I'm under the impression that you get clients, like a fair number of people come to you for endometriosis, and you have some unique things that you do that you've developed with working with this population. So can you talk to us about endometriosis and lymphatic drainage therapy? In past winters, my son has gotten dry hands that can crack and bleed. I found that giving him at least 300 to 600 milligrams of high quality fish oil really resolves this in a few weeks. This year, I started him on Jigsaw's Alaska cod liver oil because it's the best value for high quality US sourced cod liver oil. Just 1 teaspoon gives him 1,000 milligrams of total omega-3s, which just means faster results with nature's natural dose of synergistic vitamin A and D already found in cod liver oil to support immune health. Jigsaw sources their cod liver oil from Alaska, where line-caught fish are flash frozen on the boat. This keeps the fish oil very fresh, so it doesn't require more processing and deodorizing like other fish oils, which can disrupt the oils and nutrients. So when you combine Jigsaw's incredible cod liver oil with some of their other wonderful electrolyte mineral products, it's a winning combination to keep your skin beautifully hydrated year after year. You can get a discount on all of Jigsaw's products, including Alaska cod liver oil, Electrolyte Supreme, Adrenal Cocktail, and Potassium Cocktail, formerly known as Pickleball, at jigsawhealth.com with the code LessStressed10, which you can use on each and every order. That's code LessStressed10.
Yeah. So we see a lot of pelvic congestion, abdominal congestion, maybe some blockages from some of those tissue layers sticking together. So we do a lot of myofascial release. That's definitely going to be the foundation for working with clients with endometriosis. Our sessions are always like lymphatic focused, but if we're not changing the environment of where these lymphatic vessels are anchored, like how they're structured, which is through our connective tissue, we want to create some space for fluid to flow more freely. So we're doing myofascial release and working with the organs and manipulating them. So we might manipulate the uterus, release the diaphragm, kind of work on the liver and the colon, just to get everything moving and increase circulation, increase relaxation, just get all of that fluid moving. Because a third of the lymph nodes in the body are in the abdomen. It's just like very rich. It's very rich lymphatic terrain. And within the pelvis itself, there's a ton of lymph nodes that are surrounding our reproductive organs. And that's to really help maintain their health and function and to prevent infections, to clear out excess tissue, and to create that immune surveillance, because that is an entry point to the body.
I think this is probably an underrated conversation, and it just has a lot of ties to things. First, before I go off on that little tangent, I want to ask you about the third of the lymph nodes in the pelvic region, because I feel like the neck also brags that it has this stat. Is that 2/3 of the lymph nodes in the neck and in the pelvis, and the other 1/3 is everywhere?
Uh-huh.
Okay. I think it's almost more surprising that there's so many in the neck, honestly. Actually, why do we think there's so many in the neck? Just because the brain needs to drain?
Yeah, definitely brain. And then also think from an immune perspective, because the lymphatic system is such a big part of that, just our airway, the entry points to the body.
I
We got to
mean,
guard the holes.
yeah, let's be really nice to our necks. Wow. So with the pelvic region, I think about that whole like kind of trunk. And my thoughts are, do we have a lot of pelvic congestion? I think there's probably lots of reasons. Like the first ones that come to mind is sitting. But then also, I talk about this with clients because you're going to see, I would guess, bloating and other things along with this, or even you were just talking about stimulating the colon. I would expect even constipation sometimes with this congestion in general. I would feel like it's all part of the same basket of marbles because, and I would ask if stress, if you think that is a big piece of this, because when you're under stress, the blood preferentially is going to go to the arms and legs so you can run from a tiger. You're going to have less blood flow. And so I would think, and maybe I'm thinking wrong because the lymph is a little bit different, but I would think that with that fluid, with that action, not as much action happening in the central, like the trunk, that you would have backup, so to speak, or congestion. I don't know. Those are just the things that come to mind for me. Why do you think that there's so much congestion in that area?
Oh, I'm with you in regards to like the movement that may or may not be happening in the pelvis, scar tissue from surgery, lots of abdominal surgery, C-sections, tummy tucks, deep flap after cancer treatment, lots of alterations to the body physically. And so scar tissue can be a physical obstruction. lack of movement too. But then, yeah, you'd mentioned the nervous system piece. That's so big, right? Our breathing patterns change. We're not taking those deep diaphragmatic breaths. And the pelvic floor, as opposed to being a pelvic floor, it's more of a pelvic bowl and a diaphragm in itself. So those diaphragms are moving together, both the upper and the lower decks. And that's creating that rhythmic pumping that's part of the propulsion of fluid.
Mhm. I'm
And
thinking
then
about,
muscle tension.
I was thinking about how I forgot about my own C-section scar because it was like 20 years ago, which is like, how old am I? Anyway, you just forget something that's not bugging you. But I actually wanted to ask you about scar tissue. Along 20 years ago, I was getting continuing education about laser therapy, like German laser therapy for scars. And I feel like that didn't fully translate to the United States. Do you ever end up in any continuing education around that, or just all manual stimulation for scars?
All manual stimulation for me. I guess some gua sha type of training, some soft tissue mobilization with using like a scraper. Kinesiology tape. I love using kinesiology tape to create a little bit more space between those lasagna layers of tissue to lift them up.
Are you using some cupping too? Because that was the first thing that came to mind when you
Yeah.
were talking about creating space in that area.
Yes. Yeah.
So
Cupping
you're cupping
is
the
great.
abdomen?
Yes, we can cup the abdomen, the rib cage, and then you can also move them around a little bit, but also the lymphatic drainage itself, making
Yes.
sure that we're getting things moving. And we'll do a little bit of like rebounding at the end. And we have a vibration plate and a rebounder in our office. So sometimes we'll have people hop on that after, and we'll get them doing the big six before they're getting on the table.
Do you ever have people that are struggling with infertility, which I think infertility is technically defined as, I'm not 100% sure, but I feel like 2 failed pregnancies maybe is infertility. Anyway, the technicality doesn't matter. But when I'm asking you, do you have people presenting for that? It all makes sense because if you're having congestion in the trunk, then sex hormones are not a priority for your body, in my opinion, like physiologically. So I'm just thinking about the general reproductive system. So I'm wondering if people come in for that as well.
Yeah. Yeah, it's interesting. People will come in around egg retrieval to just help recalibrate their body after that like hormone roller coaster. They'll come in after, I'm trying to think. There's different areas where they'll come in on their like fertility journey. Or yes, sometimes if they're just trying to conceive, they're like, we're trying to get everything moving. We want this tissue vital and vibrant and ready to receive.
It was a great niche, I think, like lymphatic drainage for reproductive or like fertility support. I think it's great. We've even had a topic similar to that. It was essentially abdomen stimulation for fertility was generally the topic. Back to endometriosis. Do you have advice? So there's a few questions I want to start to end with around some of these topics. But my first one is, I remember you telling me once that you see a lot of weird stuff. Clients report a lot of weird stuff coming out of their body after endometriosis treatment.
Usually it's like poop. So different modalities, not that I do, but internal pelvic floor work. A lot of times mucus and things like that will come out.
That makes sense.
Clots and all kinds of wild things.
I think we have all kinds of stuff we can't see in our body because I like have lots of mucus stories from clients, like interesting things that happen. Another thing for another day, mucus sagas. Anyway, endometriosis.
Why do they always end up on a paper towel and then photographed? Then they circulate on the internet. But
I don't know that too. Okay, so what advice, if you were trying to summarize your unique approach for endometriosis, which I think you see a lot of in clinic, and then also empower a listener with how to find a practitioner, like a good quality practitioner to help them with endometriosis, what would you say to them?
I would definitely tell them to look for somebody that does manual lymphatic drainage, so clinical lymphatic drainage, just to ensure that it's gentle and safe for them, and some form of like fascial work. So I do John Barnes myofascial release, but that's just one of many modalities. Rolfing is another good one. And also there are practitioners that specifically work with just visceral manipulation. So finding a visceral manipulation practitioner can be really helpful because those are people.
do that.
Yes. And so that's a really helpful modality. And I think that combination is going to be great.
And I think you wanted to tell us something. Is there anything else that you want women to know that they can do at home around endometriosis for their self-care?
Yeah, definitely start working in the abdomen. I do usually try to encourage my clients to use a red light unit downstairs on their pelvis, on their undercarriage, castor oil packs. That feels like a very tried and true thing. And mobilizing the pelvis. There's a lot of fascial attachments at the sacrum. So if you deal with low back pain, sacral pain, the pain is concentrated on the back of the body. It's helpful to use tools like therapy balls, little like round balls where you can get in those nooks and crannies of your hips and the base of the low back between the rib cage and the pelvis. That's a good area. And there are softer squishy balls where you can actually work in your abdomen safely. So I have a little purple ball in the corner over there. It's called a Coregeous ball. They're affordable, they're grippy, and that ball is soft enough that you could use it in your abdomen. So if you're familiar, or maybe if you're not familiar, the modality block therapy has been really interesting. I've tried some different things where you're activating your diaphragm and using a block to release and open and create some space. I find that soft squishy ball is really great for doing that. So that way we can work on those areas of density and congestion. So I like to teach women how to pump their ileocecal valve, that little sphincter between the small and large intestine. I like for them to know where that is and so that they can work on it. That's a good instructional video. And there's lots of videos on YouTube that can teach you how to do that.
Very fun. So we covered some lovely pearls today on fibrocystic breasts and breast health in general. And then we talked a little bit about puffy pits and armpits and how that's related. Then we traversed down to the reproductive system and largely talked about endometriosis. I think we could probably talk for a lot longer. There's all these systems. But look at us. We didn't talk about the neck, but hey, we covered more than 30% of the lymphatic system, and that's all you can ask for in one short episode. Leah, where can people find you online?
You can find me in the club. So Lymph Love Club, I'm on, I think almost all of the platforms.
Oh, really?
Yeah. I feel like I'm
go.
on Instagram, TikTok, YouTube.
Yeah.
LinkedIn.
That's a busy life, man. Congratulations. And then we'll also be linking in our show notes your last episode. And I believe I said it was I'm looking for it. It is episode 263. If you want more of Leah, but she's great to follow online, very entertaining. Can't go wrong following her. Thanks for coming on the show again today.
Oh, thanks so much for having me.
Just keep breaking. I gotta get myself a little more faith.